All right, my name's Courtney. I'm one of the PA students that's going to be taking care of you today. I'm going to start the exam by washing my hands. I can note that the patient is in no respiratory distress. He's not in any pain, laying here relaxed. He's not having any anxiety right now. Okay, right?
Yeah, I'm good.
He looks well nourished for his age and well developed. Okay. He is ANO ×3, alert to himself, to his place, and to the time. Okay. He has normal affect when we speak in conversation, and he has normal facial expressions while I'm talking to him. Okay. His grooming appears to be well kept. Okay. Personal hygiene is in order. I don't note any foul, malodorous smells coming from him. Okay. His hair is well groomed. All right. And his posture sitting here is fine, and when he walked in today, his gait was normal as well. So I'll continue today's exam doing a cardiac exam. Okay, I'm going to begin with my patient laying supine with the head of the bed raised at a 30-degree angle. Okay? I'm going to be looking at his chest for any heaves. Okay. I'm also going to be looking for any scars around his chest, whether from trauma or from surgical scars as well. Okay. I'll also be looking for any abnormal pulsations that I can see coming from his throat or also from his chest. Okay. So I don't note any retracting, no accessory muscles being used. Okay. I'll continue with measuring the jugular vein pressure. So I'll grab a card with a ruler on it and an index card. I'm going to place this right above the sternum. I'm going to take my index card and I'm going to turn his head right to the left a little. And I'm looking at his jugular vein for, just stop chewing a second, for where the highest point of pulsation is. And then I'll go right across and I'll measure it in centimeters. It is 3 centimeters. Okay. So that's our jugular vein pressure, and that's normal for, that's in good range. So I continue with auscultating the carotid arteries. I'll use my stethoscope before I palpate. Okay. I'll use the bell.
I know, I feel like I'm yelling at my stethoscope and I'm like talking so low. I think you did.
Okay. So I'm listening to both, making sure that I don't hear any bruits and that I heard S1 and S2, which I did. Okay. So I can now auscultate the valves in his heart. So I'll start with the aortic valve, and that is in the right second intercostal space. Then there's the pulmonic valve, which is the left second intercostal space. The tricuspid valve, which is in the third, fourth, or fifth left intercostal space, and the mitral valve, which is in the fifth intercostal space. Okay, so I'll begin on the aortic valve. Again, I'm going to use both the bell and the diaphragm. I hear S1 and S2. I don't note any regurgitation or stenosis. Pulmonic valve is the same. No aortic, no stenosis or regurgitation. Okay, so I heard S1 and S2 over all valves, and I also did not hear S3 or S4, as well as no regurgitation or stenosis in any of the valves. Okay, so now that we've listened to the valves, I can do palpation. All right, and I'll begin with palpating the carotid arteries one at a time, feeling for thrills. Upstroke seems normal. I don't feel any thrills. Okay, amplitude seems normal, it's not bounding and it's not dull. Palpate the right carotid, looking for the same thing. Upstroke is normal, amplitude is normal, not bounding and not dull. And it feels symmetric with the other side. I also don't feel any thrills. Now I'll try and palpate the point of maximal impact over here. So I'm going to have him turned into the left lateral decubitus position, so just on your left side. So right below about the 5th rib. Going to feel for, okay, and I've located it right here, and I feel it pulsating. Okay, and you can lay back down for me. And I'll palpate the aortic, pulmonic, tricuspid, and mitral valves for thrills as well. Don't feel any thrills. I don't feel any thrills in these valves either. So that concludes our cardiac exam. Okay, so I'll continue with today's exam, inspecting the thorax and the lungs of the patient. Okay, I'm first going to inspect. So I'm going to look at the patient's anterior, looking for any scars, any trauma, abnormal breathing patterns. So there's no retracting noted, and I do see both sides of his chest expanding and collapsing while he breathes. Okay, I can also look at the posterior of his back, and I don't note any respiratory motions of distress. I don't see any trauma or any scars. The back is expanding bilaterally and decreasing bilaterally with each breath as well. Okay, so I can continue with palpating. So I'll begin with the posterior side. I'll palpate the 3 areas on the anterior chest wall. So just looking for any tenderness. So if there's any tenderness, just let me know. And I'm also feeling for any signs of crepitus, okay? Okay, no tenderness?
No.
So I can move to the back now. And I'll do 4 areas of the back. Again, feeling for any crepitus and asking for any tenderness. Any tenderness?
No.
Okay, no tenderness noted and no crepitus felt either. Okay, so now I can test for tactile fremitus. Okay, so I'll begin with the anterior side of the chest the same way I palpated. So I'm just going to have you say the words 99, and I'm feeling the vibrations of his voice through his chest wall. Okay?
99, 99, 99, 99,
Okay.
99, 99, 99, 99.
Okay, and it decreased as I went further down his chest wall. All right, so I'm going to perform the chest expansion test. I'm just going to place my hands on his chest and feel that both sides of his chest are elevating bilaterally while he breathes in. Just take a deep breath in. Okay. And I'll do it posteriorly as well. Deep breath in. Okay, and both sides are elevating bilaterally. Okay. I can now do percussion. So I'm going to have the patient lay down for me to percuss the front of his chest. There you go. And I'll percuss the apices of the lungs as well as the full lung with both 6 locations on each. Okay. So I'm listening rather for normal resonance throughout. Just making sure to go in between the intercostal space. Hearing normal resonance. Any pain?
No.
and I hear normal resonance throughout. Okay. So now I can auscultate. All right. Rather, I'll percuss the back, the posterior side before I auscultate. So I'll have you sit up to this side. Okay. I'll do the same thing in the 7 aspects. Listening for normal resonance throughout. Normal resonance throughout. And now I can listen to his lung sounds, okay? So I'll begin listening on the anterior side, and then we'll move to the posterior side. I'm going to listen for a full cycle of breathing, okay? Using the diaphragm of my stethoscope. Take a deep breath in. Another deep breath in. Okay, again. And again. And again. Okay. I'll give the patient a second to rest, and then I'll listen on the posterior side. Good.
Mm-hmm.
Deep breath in. Cross your arms over your chest for me. And out with your mouth. Another deep breath. Almost done. One more deep breath. Last one, I promise. Okay. So I noted no rales, bronchi, or wheezes. His lung sounds were clear through auscultation bilaterally. Okay. I'm going to do one of our special tests. So I'll do the whisper proliloquy test. So I'm going to listen on his back and have him whisper something, and I shouldn't be able to distinctly hear what he's saying. So I want you to say the word 99, okay, while I listen. Okay, so it just sounds like a staticky mumble, okay? I'm not able to make out what he's saying, and that's normal, okay? Okay, so I'll continue today's exam with an abdominal exam. Okay, I'm going to begin with inspection. So I'm looking for any obvious masses, okay, coming from the abdomen. I'm looking for any pulsating masses, so I don't note any pulsating around the aorta or anywhere else. I don't see bulging flanks, which would indicate a CAs. Okay, and I don't see any obvious signs of trauma or scars on the abdomen either. I can use tangential lighting also just to look for any masses that weren't clearly visible, as well as any pulsating masses as well. So I don't note anything abnormal, okay? And I can continue with auscultating the bowel sounds before I do anything else. I'll have the patient laying supine with his knees bent so that the abdomen is relaxed. Okay? So I'll listen in 4 quadrants using the diaphragm.
I'm sorry, my arm was in the way. Shall I?
Guys, I literally did a breather with subtitles. It's just a low gurgle, and I can hear them so far in these 3 quadrants. And the final quadrant as well. And then I can continue listening to his arteries, his aorta and his renal arteries for any bruits. No bruits heard in the aorta. Symphony is heard all throughout 4 quadrants. No bruits heard in the renal arteries. Okay. So now I can continue with percussion. Going to percuss the abdomen generally first, and then I'll look for the liver. Okay. So starting around the stomach. Noting to see if I feel any dullness over areas that I should hear tympani. Okay. Now I can percuss where the liver is. Okay, I'll do that in the midclavicular line. I'm going to get the size of the midclavicular line of the liver, which should be less than 16 centimeters, give or take. Okay, so I'll begin by finding the upper border. So I'm going to percuss from the lung until I hear a dullness. Okay, so we're dull here. Okay, so I'm just gonna have you take your finger. I'm gonna mark right here. All right, and you can relax that one. There you go. I'll continue percussing for the bottom. Okay. Okay, so that's the end of the dullness. And I can measure in centimeters, and it should be, yep, so 11. So below 16 is good. Now I can percuss for the spleen. So I'm going to have him turn towards me in the right lateral decubitus position. Okay. I'm just going to have you cross your arm right over your chest. I'm going to percuss again from the lungs. So resonance is heard. Resonance. And now we're dull right here. Okay. So this is where his spleen is. Okay. I'm going to have you turn back to normal position. All right. I'm going to have you flatten your legs and just sit up for me. And we will check for costovertebral angles. This is just for tenderness, okay? So I'll place my hand over both kidneys. I'm just going to bang on my hand, and if he feels any pain, then he has some tenderness, okay? Any pain?
No.
Pain?
No.
Okay. All right, so you can lay back down for me. Just going to do general palpation right now, okay? In the abdomen, so I'll start with light. Any areas of pain?
No.
Okay. If there were areas of pain, I would start palpating in the furthest area from the pain. Okay, so no obvious tenderness noted as I'm just generally palpating. So then I can do deeper palpation in the 4 quadrants. Any pain?
No.
And I don't feel any masses. Okay. So I'll palpate the edge of the liver. So I'm going to have you take a deep breath in.
Okay.
It's not going to hurt you. Just take a deep breath in for me. I'm going to feel under the rib cage. All right. I feel a smooth edge of the liver. Okay, you can relax now. So there were no nodules noted on the edge of the liver. Okay, it was right under his rib cage with the top of my fingers. Okay. And I can also do the same for the spleen. So I'm going to have you take a deep breath in for me. Sorry. And the spleen I can't feel, which is normal. It's usually not palpable. Okay? If the patient needed or warranted a rectal exam, we would do that at this point as well. Okay? But now we can move on to our special tests. So now I'm going to perform a fluid wave test to test for any ascites. So I'll have the patient place his hand down the midline of his abdomen. Okay, I'm going to place mine on one side and then tap the other side of his abdomen to feel fluid wave on my left hand. Okay, so there was no fluid wave felt, okay? So you can relax now. So there's no fluid in the abdomen that I felt. Right, I'll now check for Rolfsing's sign, which will indicate any acute appendicitis. So just leave your legs up for me to relax the abdomen. I'm going to palpate in the lower left quadrant, and if I press down, he would have pain in the right side referred there with Rolfsing's sign. Okay, so any pain?
Oh.
No? I can also do Murphy's point test, so I'm going to have him take a deep breath, and I'll palpate in the right upper quadrant, and this will test for any acute cholecystitis. Take a deep breath. Any pain? Okay. So there's no pain there, and there's no pain with Rolfsing's sign, so both of those tests were negative for cholecystitis and appendicitis.